I just want to share because everyone always wants to know, I did not take hormone therapy for many years. I completed my tamoxifen therapy like a good girl. And I had my ovaries removed and I dealt with my symptoms with non-hormonal options. And now, after many years, in conjunction with my oncologist, after learning so much from this amazing man, and understanding the science, I am on hormone therapy. I use a transdermal low-dose estradiol patch, and I take progesterone, and I use vaginal estrogen. And I'm not saying what I do applies to anybody else, but I think it's good for women to hear that, yeah, I'm a doctor, I understand the science, and I've chosen this for myself. And so, you know, and I know, Monica, you had your ovaries removed because of being a BRCA carrier, and you are comfortable taking hormone therapy yourself, right?
I am. I had my surgery done at Sloan Kettering. I also was sent out the door without a prescription for hormone therapy. I didn't sleep through the night for 6 months. I gained 25 pounds. I was generally miserable and a total bitch until the first night I started taking menopausal hormone treatment. I slept through the night, and the rest is kind of history. I was given at first prescription for compounded. I've literally tried everything. I've used pellets. I've had so much testosterone from pellets that it was concerning, but I stopped that. I mean, I really went on a journey for 5 years, and now, thankfully, through Dr. Bluming, through my relationship with you, Dr. Menn, and Dr. Malone, who's our chief medical advisor at Alloy, and just really being immersed in this science and data day in and day out for the last 5 years, I feel super confident and happy about the choices that I've made.
Well, I never went through those symptoms, but my wife did, who's the single most important person in my life. And she was on hormones for 30 years. The other very important person in my life is my daughter, who also had breast cancer and who's also been on hormones now for close to 8 years. So that the three of us have very personal involvements in this. That doesn't prevent us from looking as objectively as we can at the data, but clearly there is strong motivation here to stay up to date and be sure that any advice we give is the best data available.